Apparently not. Oh. Okay, can everybody hear me okay? Great. Thank you everyone for joining us today. We have a very important message from public health and our healthcare partners. Before we begin, I want to let our members of the media know that they will have the opportunity to ask questions after the initial statements. To do so, please leave your name, who you represent, and your question that you'd like to ask in the chat. We will unmute you one at a time to allow you to ask the question. In order to stay on schedule, we are going to allow for a couple questions each, but then we have to move on to make sure everyone has an opportunity. If time allows, though, we will ask if there are any further follow-ups. This morning, we are joined by Peg Curry, Providence Healthcare Chief Operating Officer, Dr. David O'Brien, MultiCare Health System Chief Executive, Dr. David Ward, Interim Executive Director of Operations for Primary Care of Kaiser Permanente here in Washington, and Dr. Deb Weiser, Chas Health Chief Clinical Officer. Together, we're here to present a unified message on the status of healthcare in our region, the efforts in place to provide care to all who need it, and the need for our entire community to follow public health guidance and to become vaccinated. We will begin with a statement from Spokane Regional Health District's Interim Health Officer, Dr. Francisco Velasquez.
Good morning, and thank you for joining us today, and thank you to our healthcare partners for joining us today. So this morning, all of us in the region that are in health, with public healthcare, have come together to share with the community a little bit of a perspective of the challenges that our hospitals and healthcare providers at all levels, hospitals, clinics, ambulatory sites, are facing as a result of this fifth wave of the pandemic. And I know this fifth wave has been called a lot of things. I would like just to make a statement about it, which is this fifth wave in about 20 months is being caused by probably the most worrisome one of the variants that we have seen thus far, the Delta variant. And the number of people that are sick, the number of people that are in the hospitals really validate that statement. It's not hyperbole. Now, we have seen our neighbors across the border in North Idaho work really hard, really diligently to fight this fifth wave, because this is not just here, it's all over the country, it's all over the world. But despite their best efforts, their systems have become overwhelmed. So they have declared what is known crisis standards of care, which I have to tell you is a very difficult and complicated decision to make. Now, in Eastern Washington, we're blessed with a breadth and depth of healthcare capacity and capability that is unrivaled in other parts of the state, and frankly, nothing to compare to in many of our surrounding states. So because of that, we're actually not in the same circumstances as our partners across the border in Idaho. But we're all part of the Inland Northwest provision of care. So what happens on the other side of the border, because we're a regional referral center for them and we're their healthcare partners, we need to be mindful of and keep track of. Now, critical standards of care in the state of Washington are declared by the state. I can tell you our facilities are not at that level, but I can also tell you that our individual providers are overwhelmed. This is the fifth time we asked them to do the almost impossible in a period of over 21 months. Providers are tired, they're exhausted, they're stressed, they're frankly overwhelmed with the responsibility that they have. And despite that, they show up to work every day and try to provide the care that we all need. And we need to thank them for that. Now, the partners that are here virtually with us today have all come together. We have all come together in the region to do what we do, which is collaborate, support each other, They're daily, sometimes multiple times a day conversations so we can each help each other, whether it's with referrals or best practices or providing clinical services or making sure that clinical services can be provided for all of us that need it. That's the reason why we're still moving forward. But today we're here for a very specific reason. And that very specific reason is despite all of those great efforts, we really can't do this alone. And when I say we, I mean healthcare. We need the community. We need each member of the community to do what they can to help minimize transmission, which results in infection, disease, and many times in hospitalization. What I'm going to ask you to do, I've asked you before. It's not that complicated. First, wear your mask. Masks do work. They've worked for a long time, and they continue to work. They're required indoors right now in public spaces, but I will strongly encourage you to do what I do, which is wear outdoors when you're around people that you don't know, or if you're in a crowded place. Indoors and outdoors, masks will work equally well. Very important, if you are sick or have been around someone that is sick, stay home. Contact your provider. You can send them a message. Don't have to go to the office. And I'm sure they'll be happy to provide you the guidance that you need. There are some basic things that we can all do that work really well for COVID, the flu, and the common cold, such as wash your hands, cover your nose and mouth if you're going to sneeze or cough, and make sure you wash your hands afterwards. Most importantly, we have the most powerful tool to manage this pandemic. We've had it for several months. Vaccines. They're effective, they're safe, they work. And very importantly, they're widely available. So what I will ask you to do today, if you haven't, and you're eligible, and that means everyone over the age of 12, make an appointment or go to the many retail establishments that are offering vaccines. It's pretty easy to do, and most of us can do it. That will certainly help in the long run. Right now, in the short term, the infection control measures that I just shared and masking is what is going to help us immediately. Vaccines do take a little bit to provide that protective effect. Now, I'm joined here today with our partners who are going to talk about some of the specific challenges that they face. And I will going to call first our healthcare partner and colleague, Peg Curry, who's the Chief Operating Officer of Providence Health in the region. Peg?
Thank you, Doctor. Greetings, everyone, and thank you so much for joining this conference. I'm the Chief Executive for Sacred Heart Medical Center and Children's Hospital and Holy Family Hospital. And I'm here to tell you that we're at a very serious point, not just in Providence, but overall in our hospitals, with the number of patients that we have in our hospitals that are COVID positive. As Dr. Velasquez said, the Delta variant is much more contagious than what we saw earlier. For every one person who is infected, they can infect 6 others. And think about that. That's very staggering when you think about small groups and large groups and the possibility for further spread of this. That's just how contagious this is. Here at Providence right now, we have 150 patients at Sacred Heart and Holy Family that are COVID positive. That's the most we've had. You know, it's not a record that we wanted to break, but we have broken that. Many of these are in our ICUs, and everybody that is in the Sacred Heart and Holy Family ICU now on a ventilator is not vaccinated. This is a preventable disease. And we also know that once on a ventilator, the mortality or the risk of dying is very high, approaching 50 to 60%. And this is a preventable disease. So I just implore you to follow Dr. Velasquez's suggestions about masking, but vaccination as well. To show you how serious this is in our organizations, we are halting elective procedures. We had reduced procedures prior. We are halting elective procedures going forward because we are continuing to have an influx of patients coming into our emergency rooms and demand for ICU beds to be extraordinary. So that would mean elective heart caths, that would mean endoscopies, that would mean elective bypass grafts. So this is more than just impacting people with COVID. This is impacting the health of our communities. Healthcare is a limited resource, and some of our caregivers have been exposed and have COVID as well. We are part of this community and we need your help. Our nurses and doctors are exhausted, and imagine caring for 750 dying over the last 18 months. That's equivalent to 5 737 plane crashes just in Spokane County alone, to give you some perspective on this. I'd like to share my experience with you in seeing COVID patients and what it's like for them in the hospital. For those patients not yet on a ventilator, they're gasping. They can't get a full breath. They have to sit up to breathe and lean forward. They're exhausted from trying to breathe. They can't sleep because they can't breathe. It is misery. For those that are on a ventilator, they're given medicine to keep them sedated. They're turned every few hours from their back to their bellies to try to keep their lungs more healthy and to help them heal. The age group that we're seeing in the hospital is mostly between 40 and 50 years old, much younger than what we saw previously. And so we have an ask from you. We know that you appreciate our nurses and doctors. You've called them superheroes, but they aren't feeling like superheroes right now because they've seen so much death over this long period of time. We're asking you to put political views aside and to stand by your nurses and doctors and your healthcare systems in solidarity by masking in public, by avoiding large crowds. Masking does work. It holds those respiratory droplets that transmit the disease, so it will decrease the spread. We have a lot of super spreader events going on right now, and I know people are looking for fun and a break and all those things, but be cautious in your choices there. There's fair and there's a football and there's other gatherings, probably weddings. Please be cautious in your choice. If you do choose to go to an event, indoors or outdoors, please mask. And also, the vaccines are safe. Pfizer is FDA approved and it's gone through rigorous testing to get that approval. So we're asking you to help take care of us, take care of others by masking and getting vaccinated. Thank you.
Thank you, on mute. So again, I think I was supposed to go next. So good morning, everybody. I'm Dr. David O'Brien. I'm the Chief Executive for MultiCare here in the Northwest region. It's a pleasure to be with you all today. It's really amazing how things can change in just a few weeks. About a month ago, in our hospitals, we had 6 or 7 COVID patients in the 2 hospitals. Today, we have 74. 12 of these patients are in critical care. A whole 11 patients in the emergency department. And this is all layered on top of the usual kind of medical problems that come to the hospital. Our hospitals have been running at over 90% capacity in the past few weeks. We're really not much different than any other hospital. We're seeing this younger demographic that has been being admitted to the hospital. I received a report from the Washington State Department of Health that more than 92% of all cases, hospitalizations, and deaths in individuals 12 and older are attributed to individuals that have not been fully vaccinated. And Peg just mentioned that in their hospitals, those numbers are bearing out, and we're seeing the same thing in the Deaconess and the Valley. These patients that are ill with COVID have not been vaccinated. The Department of Health also reported that only 49% of Spokane County residents 12 and older are COVID. So we really have some opportunity. Like other hospitals in the state and here locally, we've taken steps to address this. We have opened dedicated COVID units. We've also canceled all non-emergency and elective procedures. So as Peg was saying, this means that patients that they're going to have to postpone screening tests and other non-emergency conditions. This is very concerning because we don't know what that impact is going to have down the road in creating more significant medical issues because of these delays. This has allowed us, canceling the surgeries allowed us to redeploy all of our surgical teams out onto the floor to assist in the ER, to assist in the ICU, and the floors. And even our surgeons have been helping caring for COVID patients. They have much less surgery. And our administrative teams have been out working in the hospital, supporting ES workers, food service workers, etc. So this has really been sort of an all hands on deck situation for our teams. We're very concerned about the situation in Idaho, where they have declared crisis standards of care. We're doing everything possible to avoid that in our region. So my ask is very similar to Dr. Velasquez and to Peg Curry's and to the speakers that are going to come after me. Is please adhere to the recommendations Dr. Velasquez just outlined. Wear a mask indoors, outdoors, whenever you're around people, proper hand sanitization, and avoid attending potential super spreader events. My message is you trust us, your medical provider, to take care of you when you have a minor problem or you have cancer or a heart attack. Please trust us that when we encourage you, when we recommend that you get vaccinated, it's the best way to control this epidemic, the best way to protect yourself, your family, your loved ones, and our community. So thank you very much.
So who's next? No, that's okay at the end.
Good morning. My name is Dr. David Ward, and I'm the interim medical director for Kaiser Permanente, and I believe I'm next. I wanted to start by amplifying and strongly resonating with the amazing comments that I just heard from my colleagues, Dr. O'Brien and Peg and Dr. Velasquez, and really amplifying that from Kaiser Permanente. I wanted to start by sharing a story. I'm a family physician, and my colleagues and I that are family docs, we really value building strong relationships with our patients. And I'm seeing something new in clinic these days. What I'm seeing is I'm seeing patients that are now suffering with the long-term chronic effects of a COVID-19 illness in clinics. It's new. I've never seen that before in my career, and it is heartbreaking. I'm seeing my patients that are coming in 3 months, 6 months, a year after a COVID-19 infection, still on oxygen. I'm seeing my patients that are taking chronic inhalers, seeing my patients that still haven't returned to work because of brain fog or concentration issues, that they're not able to function at a level they were before. I'm seeing these chronic conditions over and over again of people who have had COVID-19. And I ask every single one of them, did you get the vaccine? And so far, my answers have been, no, I didn't get the vaccine. And so I quickly ask, have you been vaccinated now? And they all say, absolutely, yes, now I've been vaccinated. And so I say, okay, now we've got these chronic conditions. You're on oxygen, you're sick, you're now vaccinated. What would you tell me to tell one of my other patients that is still considering getting this vaccine? And they say collectively and strongly, they say, please tell your patients who are considering the vaccine, don't wait to get the illness like I did, or to have you or one of your loved ones get the illness and suffer these devastating side effects. Because we have a vaccine that's safe, this vaccine is effective, and it is drastically changing the course of your disease. For reference, when we're testing, and we have ample testing for COVID in our community, almost 1 in 3, 29% of our tested patients are coming back positive for COVID when they're unvaccinated. In our vaccinated members, they're almost all asymptomatic when they're testing positive, and the rate is much, much lower. We've got a vaccine that can keep you safe and protect you from some of these chronic conditions that we're seeing in clinic. And so I say that from the bottom of my heart as a family physician, please, please, please consider getting a safe and effective vaccine. Thank you very much.
Dr. Weiser.
Oh, there I'm good. Good morning. I'm Deb Weiser, Chief Clinical Officer for Chas Health. Thank you for taking the time to join us. As we ask our community to help us during this surge of COVID, I definitely want to echo the comments of my predecessors on this call. They really dig into the details, and I agree with really every word that has been said so far from Peg and David and all those spoken. The strain in our healthcare system, from our local hospitals to the urgent care settings, is having extraordinary, and our primary care clinics is having an extraordinary impact on our community's ability to access care and putting a huge strain on our healthcare workforce. This is due in part to the hospitals being overburdened. So at Chas Health, we're seeing sicker patients coming into both our urgent cares and our primary care locations. These sicker patients take more time to care for, which creates a backlog in schedules, limits our COVID-19 testing abilities, and that can be exhausting to our staff as well. And as those others have mentioned, this has been the long haul. So the reserve is less than it was when we started this 21 months ago. These challenges have required us to make several changes. We've had to dramatically limit the amount of COVID testing available to our community, and we're educating our patients and community members who arrive about mail-in options. Our patients who arrive at our clinics with a scheduled appointment for another ailment, but who have those symptoms are still being tested, but we don't have the staffing to provide those testing only appointments and be that community backstop like we were before. We've also had to limit our urgent care location hours over the past week, and we'll be transitioning to some walk-in or video visit availability. All of these changes are due to the impact that this surge has had on our workforce and our ability to staff our clinics appropriately. We want our community to know that your health is important to us, but we need to work together as well. That means being patient when when appointment or phone call holds take longer than expected, and knowing that our staff is running as quickly as possible to meet the needs of patients we're serving. Vaccination remains the best way out of this pandemic, and I'll just echo what was said about that by the others on this call. And we just urge you to educate yourself about the vaccine and talk with a trusted healthcare provider if you have questions. Our whole mission and goal when we care for patients is to provide the best information we can about making the kinds of decisions that will keep you and our community healthy. And we ask for that level of trust to do so. We are also offering walk-in vaccinations at all Chas primary care medical locations for anyone who needs a vaccine, and those vaccines are widely available across the community. And again, I'd like to echo the use of mask wearing indoors and outdoors when you are around other people, especially people that you are not aware of their vaccination status or you don't know them. Thanks for your time.
Thank you to all of our healthcare partners. Before I pass the microphone to Kelly to moderate the questions, I just want to make a couple of comments that I think will give you some additional context. So if we look at September the 2nd this year, at a national level as compared to September the 2nd last year, we saw a 300% increase in the number of cases. And over 95% of those cases are unvaccinated. Over 95% of the cases that are in most hospitals are unvaccinated. We also saw, for the same day, an 86% increase in mortality across the country compared to the same day last year. Something that worries me a lot is we also saw children become 27% of all new cases. We know in the past that we said children have a lower transmission rate, but I do have to tell you, Delta is changing that equation because it's very effective at finding unvaccinated hosts. And right now, we do know that our children under 12 cannot be vaccinated yet. So the reason why I bring that up is to give you some context as to what our providers, hands-on, boots on the ground are seeing every day. Think about having 300 times more of a workload that was already almost impossible a few months ago. So think about that context, and I will encourage you to really follow our advice. We do have your best interest at heart. We really do. All of us have seen patients die. And it's not easy for anyone to see. Trust me, I've been there many times. And it's not something that you get over. It's not something that you can manage really well. It takes a while. And having seen it so many times over the last 20 months, it's an impossible burden. So please, wear your mask, get your vaccine, wash your hands. Let's come together and do what we do best, which is collaborate and take care of the community. And each one of us has a contribution to make. So with that, I'm going to ask Kelly to come to a microphone to moderate some of the questions. Thank you.
I think I can do that from right here.
Oh, I don't have to move.
We are going to unmute our panel and ask questions. Just a reminder to all the media that are on, if you have a question, please indicate so in the chat and indicate who you're with. I know that we have some new media folks on here that I work with on a regular basis. So if you could please indicate who you're with and your question. First up is going to be Whitney Ward with CREM. Hi, Whitney.
Good morning. Thank you so much. I appreciate all of your availability. I just have a couple of questions, so I'll start with three, if that's okay. And I don't know if we want to ask all three, but I would like to make sure that I have that opportunity to ask these three questions. First off, what is the plan for increasing pediatric ICU capacity? We've been hearing that the numbers of available beds are fairly low. What happens if we have more child patients than we have beds available?
Hi, Whitney. This is Peg Curry from Sacred Heart. And knowing that we have the Children's Hospital, I'll take that one. Right now, we've had a few children so far, and we still maintain a full staff ready for any kind of intensive care capability as well as general pediatric care. Fortunately, we haven't seen a lot of pediatric hospitalizations yet. We have been watching across the country to see what the trends are, specifically in those states that are even more highly unvaccinated than we are, so we can get an idea of what to expect. But right now, we're well positioned to care for additional pediatric patients.
Oh, hold on, Whitney.
There we go. Thank you so much. Okay, thank you very much for that answer. I appreciate it. Also, what is being done right now? We've been hearing so much about people who are trying to find COVID tests, and the availability of tests just is not there for the number of people who are looking for those tests. What is being done to try and increase the availability of those tests here locally?
Well, let me start, and perhaps my other colleagues will add to that. So basically, if you look at the testing, we do have a capacity to do clinical testing. And what we're seeing is a demand, incredibly high demand on the consumer-based side, on the community-based side. Testing that is needed for reasons other than immediate diagnosis. As our providers have mentioned, they're trying to focus on that. And one of the things that we have done is reach out to the Department of Health to help us with the potential of having community-based testing site or sites. And right now, actually, as of today, we're working on that option, which is looking like something we may be able to do, provided all the resources are there from the Department of Health. And the goal behind that is to make sure that those of us that need testing for reasons other than indicated by our physician for clinical reasons, we can get access to testing, whether it's for events or because it's required a particular venue or because of travel, that we can get that at a different site other than going to our urgent centers or primary care providers or others. Now, there's also a movement to increase the capacity of pharmacies that the Department of Health at the state level is also working on, because that will provide us more points of access too. So it's something that we're working on very diligently, but as you can imagine, the supply and demand is not unique to our area. It's pretty much all over the state, all over the country. So we're all trying to work with the same resources, but we're keeping our fingers crossed that we will be able to provide in the very near future some additional options that are community-based.
I would just add from the Chaz Health side, given that we'd had a pretty strong presence on the initial centralized testing last year, our approach this year, given our shortage in staffing, has been to attempt to utilize methods that don't require as much staffing. So really that's the mail-in option. And I think you'll be seeing more of that availability through larger retail stores as well. But when people are seeking testing without medical evaluation, which is a common scenario, then we'll be helping to connect people with mail-in options. And that can have a pretty fast turnaround as well. And it's a good way to be a lot more efficient about use of our healthcare worker time and efficiency.
Thank you. We have heard a lot about how many of our facilities are understaffed, completely understaffed right now. Can you give us a picture of what that really means when we talk about nursing? How is this affecting COVID patients and then patients in other areas of the hospitals? And also, is there any possibility of requesting help from perhaps the state level or the federal government to assist so that the staffing isn't as much of an issue? And lastly, is there any reason not to be starting monoclonal antibody clinics, outpatient clinics for COVID patients, or is staffing a reason that we're not doing that yet?
Well, I'll start. There was a lot of questions in that question, Whitney, so I hope I'll tackle the staffing one first. That's part of the reason that our hospitals in Spokane have reduced or halted elective procedures, because we're redeploying staff from other areas to help support our critical care and adult med surgical areas. And the second question, I believe, was, have we asked? And yes, we have. I think there's this big thing that got in the way, and was called Hurricane Ida or Henri or whatever, I can't even remember now, and then a lot of flooding that dispersed some of the support staff into those finite situations. This is more of a chronic situation for most hospitals. So yes, we have. Have we received any yet? No, we haven't at Providence, but I think that there is going to be an opportunity for us to receive some support in the coming weeks. And the last question had to do with monoclonal antibodies. We have started delivering monoclonal antibodies in some of our Providence clinics. And the infusions take a while, and we're really kind of stepping that up. Up in Stevens County, we do have drive-by testing for patients that are concerned about positive tests, and then referrals for receiving monoclonal antibody up there as well. So you're going to see a lot more growth in that in the coming weeks.
This is David. Frank, can you hear me better now? I've made a change in my connectivity. Is that a little better? Oh, good. I apologize for that earlier. Yeah, and I'll just echo Peg again that we've done the same thing by redeploying our operating room staff. We've been able to augment the ICU, ER, and the floor staff. We're tight in certain areas, like respiratory therapy is very, very strained. COVID is very much a respiratory illness. They're working very, very hard, as all our staff are. I think the big message here is we're holding our own, but we're stretched. And the deploring outcry to please avoid super spreader events, don't tip us over the edge, please get vaccinated so we can pull back from this dangerous place where we are. We are committed to caring for our communities. Our doctors and nurses and all of our providers have a deep, deep commitment to providing absolutely the best care possible. We do not want to be in crisis standard of care where we have to start making less of those kinds of, we have to start making decisions that do not allow us to provide that kind of care. So we're hanging in there staff-wise, but we could certainly use some relief.
Can I just follow up to what you just said, Dr. O'Brien? You mentioned crisis standards of care. Are we close to that? How close are we to having to institute crisis standards of care?
Oh, he's on.
Oh, there you go. You know, that's a complicated question. I defer to Dr. Velasquez. Making the decision to go to crisis standard of care is very complex. I don't, at least in my hospitals, I don't believe we're there today. I do believe that we're stressed, and that's why we came together today to present this message.
From a standpoint of Providence on that question, I just like to kind of add my 2 cents with that too. We want to do everything we can to avoid crisis standards of care. We're working with the Hospital Association and several of our hospital partners across this state to try to make sure that no hospital has to go to that extent. So what does crisis standards of care really mean? And you know, that's something that I hear people say a lot about, and certainly it would send a community message. There are some legal liability relief that you get, but I'm not sure how much. Would it help us get more staff into our community? I'm not sure, because I think everybody's asking for the same kind of thing. When those crisis standards of care are actually declared, what it means is you're rationing care. You're making choices through a good team of physicians and ethicists in determining who's going to get what. And that is a very scary place to be for our country, our state, and we're working together very hard to avoid that. I agree with David, we're in a stressful position right now, and that's why we're here to implore all of you to get vaccinated, to be cautious, to avoid large gatherings, and to mask up.
Thank you. I think Peg and Dr. O'Brien summarized the issue very well, and I just want to make a point to stress the fact that what we want to do is prevent all of that, which is what we're here today, because it's within the community's control to actually prevent more infections, and infections to such an extent that we will even have to contemplate something as we have discussed. So what we're trying to do is prevent it. Now, we talked about monoclonal antibody therapy, which is a great therapy, but that means that you are all already infected. So let's get upstream and prevent it. And vaccines, masks, avoiding certain environments in which there is high risk is actually the best way to do it. And frankly, something that all of us can do with our families and friends. We just have to think about our activities. It's not that difficult, and I'm not trying to minimize it, but we can certainly all do it. Thank you.
Thank you, and thank you, Whitney, for your questions today.
Thank you.
Next up is Ariel with the spokesman. Ariel, we're unmuting you now.
Thank you. I have 2 questions. First, what do you say to people who do not have healthcare providers who need that clinical testing and are symptomatic? Where should they go to get tested? And secondly, this question is for the hospitals. Are ICU beds in highest demand right now, and have MultiCare and Providence expanded their ICU capacity already? Thank you.
So let me start that, and then our providers can add to the testing question. So if anyone can go to our website, and you will see a listing with links to all of the places that offer testing. And many of those are community-based. You don't necessarily need to have, quote unquote, a primary care provider, but I will encourage anyone that is either symptomatic or believes that they have been exposed to someone symptomatic to contact a provider. And if you don't have a provider, I think testing is probably the best route to pursue. Although I always hesitate to do that without having some clinical evaluation. And Dr. Weiser alluded to that. I think making sure that you have the appropriate guidance from the clinical provider is always the best first step to do. If you're just curious or you need it for something else, like an event or because it required a venue or a particular activity, go to our website. There are many retail-based testing options that are available to you. and you can make an appointment. Some of them you can just go in. Some of them you have to make an appointment, but I would encourage you to do that instead of going, for example, to an urgent center if you don't really have a clinical reason to be there. Let's keep our clinics, our urgent centers, our primary care providers, our emergency rooms particularly, for those that actually need it. So that's the best way that we can look for testing. And as Dr. Weiser mentioned, there are right now a number of mail-in options that are also available on the consumer side. And by now we're all used to ordering things remote and ordering things in the mail. We all do it for all kinds of things. So if it's for your own benefit, for your own knowledge, or for one of these events or other activities that requires you to have a test, a negative test, please use the retail options or use the mail-in options as much as you can.
Yeah, so just to reiterate from the Chaz Health side, we are definitely going to be making some changes to help connect people to those tests as well. And I'd just like to ask the moderator to open up the mic for Jason Campbell from Chaz Health to talk about that a little bit more.
Yeah, so on the chaz.org website, there's a link to at-home tests that patients and non-established Chaz patients can order. Tests will be delivered via the mail within about 1 or 2 days, and it takes about 2 or 3 days from the time that the test is mailed back to the lab to get the results.
In regards to the question about ICU space, you know, as we look at various methods, whether it's now or other situations, we already have protocols and guidelines in place with where we expand into for ICU beds needed or things like that. So just an example, last night at Sacred Heart, we had several trauma patients. And so while they were in surgery, we were able to get the staff to be able to care for them in the recovery room, and some were held in the emergency department as we really focus on what are the needs. We do have protocols in place for the things that we practice, the safe tables we practice for disasters in the area that outline for us well in advance where we're going to expand into. Yet, I want to make sure that you understand that as we approach these things, there's 3 things: it's space, staff, and stuff. And just because we have the space doesn't mean we have the staff. So we have to make sure that we're supporting our critical care and our adult med surg staff with others, redeploying them from other areas to try to make this whole plan come together. Not ideal, but we do have that in place to make that work.
A similar situation at the MultiCare hospitals. We've maximized our existing ICU space. So the units are full. We haven't gone to another floor and opened a new ICU at this point. We have contingency plans in the future. We have to do that. But again, as Peg says, it's about you have the nursing staff and the capability to staff something like that.
Thank you, Ariel, for your questions. Now we have Eleni with KXLY.
Thank you so much for your time today. Over the past 20 months, you know, health leaders have asked people continuously to mask up, get vaccinated. What else can you guys do to drive that message home? I mean, you're here providing a unified front about what's going on with COVID. And at what point would Spokane have an indoor mask mandate?
Well, let me start, and then our healthcare providers can contribute. So there is in public spaces a requirement already for indoor masking. And personally, all of us have been telling everyone, mask, whatever you are. Now there is a masking requirement that will go into effect next Monday for outdoors events over 500. And I was asked this question yesterday and said, well, my recommendation is Friday, Saturday, Sunday, the risk is kind of like the same. So you may want, why don't you just start wearing your mask today if you haven't? So we have done as much as we can with the messaging. I think the governors and the Secretary of Health proclamations and requirements are extremely helpful, because they not only reinforce the message, but then make it also mandatory in many areas. And in terms of vaccination, as you have seen, not only the federal government and the state government, but many employers, many venues, many events are requiring proof of vaccination. So I do believe that everybody's coming together around masking and immunization as much as they can as a community. But those efforts will not generate 100% success because remember, we still have a percentage of the population that is not eligible for vaccines. We also have a small percentage of the population that cannot wear a mask. So that's why it behooves all of us that can to actually do it as much as we can. And those that are not able to please minimize the risk by following some of the guidance that we have provided throughout this, this conference.
I hesitate to comment on mandates. I will make the comment that as a healthcare provider, as a doctor, working with clinical staff, that this is an ask of us to our patients to take our advice as trusted healthcare providers. You trust us with your heart attacks, you trust us with your delivering your babies, you trust us to take care of your cancer. You know, we're here for you, and we implore you to please follow our medical advice. As Dr. Velasquez said earlier, you know, our intentions are honorable and good in this regard. We're looking for the community to take care of each other in this situation.
Well said.
Thank you. Eleni, do you have a second question?
No, I do not.
Thank you very much for that one. Lastly, I think right now we have Rebecca with Spokane Public Radio.
Hi, this is Rebecca. I guess my question is when it's for Peg Curry and Dr. O'Brien. So when let's say I needed to go to the emergency room either for COVID or something else, like maybe a stroke or an injury or something like that, would I potentially be facing a longer wait time, or, you know, though we're not in the point of rationing care, is there other ways, like, for example, wait times that care might be affected by the number of COVID patients?
For Providence, we are seeing it ebbs and flows like ERs do normally, but we are seeing an extraordinary number in the emergency rooms. Our teams do triage these to take care of the sickest first. And we do separate those that might be infectious from those that we don't believe are. It is challenging, and we have wait lists for surrounding hospitals of patients who need ICU or other care from our regional communities that need the care. So there's delays around here, not just in our own emergency rooms, but from those that are seeking a higher level of care that can't be provided, say, in critical access hospitals.
I'd say hard to add to that. It's very, very challenging. The wait times can be long. You know, it's a minute by minute, hour by hour sort of things. It ebbs and it flows. And I would like to make the point about how hospitals, not just in Washington, but also the hospitals in Idaho, how we all collaborate and work together. So there's a real commitment within healthcare to, you know, we're competitors in some ways, but in a situation like this, if we have an open bed, we'll take the patient. If Prov has an open bed, they'll take the patient. I mean, we work together. We have a very sophisticated communication system. We're all in touch with each other all the time, and everybody is working their best to provide care to the patients that need it and in the right setting as quickly as we can.
Rebecca, do you have a second question?
Nope, just that was my only question. Thank you.
Thank you. Amanda Rowley with CREM has one follow-up question.
Hi there, Amanda Rowley here. So at what point do health officials stop asking the public to practice safe social distancing and masking and start mandating?
So Since everybody's looking at me, let me try to answer the question. That's a very complicated question. It's a very complicated balance. And the reason for that is we do prefer for people to follow the advice we're providing because it's not only sound clinical advice, it's in their best interest. Do we have the ability to really set requirements? Yes, we do. But requirements may or may not work as well. So that's why we're encouraging everyone today to actually do what is right and do what is best for the community. We have seen already 2 requirements come from the Secretary of Health and the governor. And I know some people see that as maybe a step backwards, but I just see that as a way to mitigate where we're at so we don't get worse than when we are. You have to remember the numbers that I quoted to you were at the beginning of the Labor Day weekend. We don't know what the Labor Day weekend may look like 2 or 3 weeks later because of potential activities. So our goal right now is to try to mitigate as much as we can with the tools that we have and the tools that are available to the public pretty much everywhere for most. We do understand that there are some individuals that may not be able to get vaccinated. We do understand that there are some because of age or clinical condition that may not be able to wear a mask. But for the most part, most of us can. So if the vast majority of the people does that, we will do much better. All you have to do is look at the modeling that has been presented, where the most immediate thing we can do to start to bend that curve is about a 90% mask compliance for all of those that can. I think that speaks for itself. So I know it's a long-winded answer, but it's a complicated question. And we do have a lot of respect for our community. We do have a lot of appreciation for our community. And we do know that our community, when called upon, will always come together and do the best. So today, we're asking you to do the best that you can do to prevent transmission.
Thank you. If I could follow up to that, if there's a minute.
No, we really gotta. I'm sorry.
Okay. Thank you.
I'm sorry, Amanda. But I know that everybody's got really tight schedules and we promised them an hour at the most. So I appreciate you all being on and I appreciate all of the very thoughtful and serious remarks that were shared today and the media for asking very important questions. Thank you very much. Have a good day.
Thank you.
Recording stop.